Good afternoon, everyone. Reported cases of COVID in Ontario and Grey Bruce seem to have plateaued or be on the decline over the past week, with cases in both Ontario and Grey Bruce down about 20%. Due to the limitations on testing, this data must be considered less than robust, but we can take some encouragement from the fact that the positivity rate also shows evidence of plateauing or declining. Currently, there are reported to be 34 active cases in the Blue Mountains. The number of people in Ontario hospitalized continued to rise, although at a slower rate than the previous week, with 4,061 people hospitalized as of yesterday. Numbers in ICU and on ventilators were also up. Deaths increased from an average of 30 a day to 46 per day. Currently, there are 15 people hospitalized with COVID in Grey Bruce, and sadly, one person from Grey Bruce died of COVID this week. The data shows that having 2 doses provides good protection against severe illness and hospitalization. The ability to prevent infection, which had dropped to 15% after the arrival of Omicron for people who have received at least 2 doses, has now risen to almost 60%, reflecting the effect of people who have received boosters. The latest data from the science table shows that if you are unvaccinated, you are 2.3 times more likely to get infected, 5.1 times more likely to be hospitalized, and 10.6 times more likely to end up in ICU than people who have received 2 or more vaccinations. It is therefore most important that you get your booster shot as soon as possible. A complete schedule of planned clinics in Grey Bruce can be found on the Grey Bruce Health Unit website at www.publichealthgraybruce.on.ca. The next public health unit clinic in the Blue Mountains is at the Beaver Valley Community Center from 12 noon to 6 p.m. on Monday, January 31st. In addition, Dr. Tim Remiard is offering vaccinations at the Blue Mountains Community Health Center in Thornbury. All community members are welcome. Appointments can be made online by visiting patient.mediohealth.com/booking/Dr. T.G. Remiard. Vaccines are also being offered at the Thornbury Pharmasafe. To be placed on the appointment notification list, please visit thornburypharmasafe.media.ca/schedule. With key public health and healthcare indicators such as percent positivity, which has fallen, and new admissions to hospital, which have started to stabilize and the length of hospital stays shortening considerably, the Ontario government, in consultation with the Chief Medical Officer of Health yesterday, released details of steps to cautiously and gradually ease public health measures starting on January 31st. Ontario will follow a cautious and phased approach to lifting public health measures, with 21 days between each step. Effective January 31st at 12:01 a.m., Ontario will begin the process of gradually easing restrictions while maintaining protective measures, including but not limited to: 1, increasing social gathering limits to 10 people indoors and 25 people outdoors, increasing or maintaining capacity limits at 50% in indoor public settings, including but not limited to restaurants, bars, and other food and drink establishments without dance facilities, retailers, shopping malls, cinemas, meeting and event spaces, and other spaces where the public gathers, such as museums, galleries, and religious services, rites, or ceremonies. Also, they will be allowing spectator areas of facilities such as sporting events, concert venues, and theaters to operate at 50% seated capacity or 500 people, whichever is less. Enhanced proof of vaccination and other requirements will continue to apply in existing settings. The province currently plans to ease these restrictions further on February 21st, 2022 and March 14th, 2022, subject to stable or improving health indicators. To manage COVID-19 over the long term, local and regional responses by public health units may be deployed based on local context and conditions. I urge everyone to go and get their booster doses and adhere to current public health and workplace safety measures. These measures have gotten us to a point where the province is starting to remove these restrictions, and we must continue to prevent the transmission of COVID in our community by following the measures in place and by vaccinating those who have not yet received their doses, in order that we not go backwards and go back into lockdown. To support businesses required to close or reduce capacity, the government has launched the Ontario Business Cost Rebate Program. Through the new program, the government will provide eligible businesses with a rebate payment of up to 100% of property tax and energy costs they incur while subject to these restrictions. The government is also introducing a new COVID-19 small business relief grant that will give businesses subject to closure under the modified Step 2 of the Roadmap to Reopen a $10,000 grant. In addition, the government is also improving cash flows for our Ontario businesses by making up to $7.5 billion available through a 6-month interest and penalty-free period for our Ontario businesses to make payments for most provincially administered taxes. These programs are great news for our local businesses who have suffered through the last lockdown. Have a great weekend and stay safe.